trauma can be different for people. No matter how small you think your trauma is, your pain is valid, and I hope people look for appropriate therapy.
Hi, everyone, and welcome back. Today, we're diving deep into the transformative topic how to heal your generational trauma and become a cycle breaker in your family. And if you've ever felt like you're carrying emotional baggage that doesn't even belong to you, you're not alone. Many of us experience the weight of generational trauma without even realizing it, and breaking free from those patterns can feel really overwhelming. Today, we are joined by Dr. Christina Michael, who is the founder and clinical director of the Cyprus Institute of Emotion Focused Therapy, where she splits her time in between seeing patients and supervising or training mental health professionals. Thank you for being here with us today, Christina.
A real pleasure. Thank you for inviting me and for doing this such a meaningful work for our community.
Absolutely. Let's start off by you briefly explaining to us what actually generational trauma is and how it gets passed through families.
Sure. Before we say anything about generational trauma, I want to highlight that trauma. Also, I want to highlight that we cannot predict what kind of words can be triggers for people. So, if anything, if you feel that you got triggered by something we say today, please try to give space to whatever triggered you and try to be curious towards it. Just know.
Wow, Christina, I love that you kind of put this out there. Absolutely, right? Trauma can feel so different to many of us. And at the same time, there is a saying that I think it's from Gabor Mate who said trauma is not what happened to you, it's often in the silence of what didn't happen to you, what you didn't have, right?
Absolutely,
And
yes.
so I think we're talking about kind of complex generational trauma, complex, childhood trauma. And so thank you also for pointing out that if you feel triggered, please make sure you take good care of yourself.
Sure. So you asked me what generational trauma is.
Mhm.
Uh, Generational trauma, also known as intergenerational, refers to the psychological effects of trauma that are passed down from one generation to the next, and it can occur both in a group or individual context. The term most commonly applies to groups who experience systemic or collective trauma, like refugee groups who flee conflict and pass on the psychological effects of war to their descendants. But it's not exclusively tied to group. The effects of traumatic experiences can also be passed down within families due to personal experiences such as abuse, neglect, or mental illness. In this case, the trauma affects an individual and can be passed on to their children. It occurs when the impact of a traumatic event experienced by one generation remains untreated and continues to impact the behaviors, the beliefs, the emotional well-being of subsequent generations through the narratives of their suffering, epigenetics, family dynamics, modeling and mimicking behavioral or emotional styles in the family. So,
So if you would cut it down into a small example, then it's something like, let's use the refugee family. As a refugee, I can very rely on or relate to that. And so it's something like your grandparents have been in war and they felt unsafe. So they felt very protective of the children and couldn't be emotionally available. And so maybe your mom or dad felt then, kind of lonely in their pain, unseen, growing up in fear, but not feeling validated in that fear. And then they bring, dad within the relationship with you because they haven't learned how to validate your emotions and see you. And so they bring that sense of loneliness and not knowing how to be emotionally available into the relationship, maybe even the fear of overprotectiveness. And then they react in a similar way like their parents did, which has a similar impact to you. And that's why that becomes a cycle and generational.
absolutely. Intergenerational
Mhm.
trauma is really about interpersonal transmission of unprocessed trauma. So, if we take your example of first generation survivors, war survivors, often
Mhm.
experience extreme physical and emotional trauma, such as witnessing death, starvation, and persecution. Many suppressed their emotions to survive, and those manifest as anxiety, depression, or inability to express affection. So the second generation, their children, may grow up in households where the fear and hypervigilance are prevalent. They might inherit an acute sense of responsibility or guilt stemming from their parents' unspoken expectations or emotions, unhealthy coping, avoidance. Some studies actually show that these children are at a higher risk for anxiety or even
Mhm.
PTSD. I come from Cyprus. Cyprus went through war in 1974, and I very often see clients, the second generation, the children of war survivors, experiencing PTSD symptoms
Mhm.
like nightmares of themselves being in war zones, and they haven't experienced war. So their children, as adults, they carry experiences almost as if they lived that experience themselves. And then we have this third generation, and even if those people have not directly interacted with the trauma, let's say the war, the grandchildren might inherit behavioral patterns or emotional responses, such as avoidance of certain topics, distrust of authority, or a strong desire to protect family traditions. Often it manifests in patterns of emotional avoidance, be strong no matter what, a fear that a disaster will strike soon, so be prepared,
Mhm.
or dysfunctional relationships. So parents who have experienced terrible things may become, as you said, all uptight in the presence of their children or being overprotective. So to summarize, right?
Yeah, absolutely. I mean, that was a beautiful way to explain how, it's often not even in our awareness when we feel similar feelings or, have those behaviors and patterns that we're not doing it consciously, but it's kind of so subconscious. And
Yeah.
so let's talk about healing. How can someone start breaking that cycle?
So, I mean, the cycle that we're describing really demonstrates how unresolved trauma can influence family dynamics, coping
Hmm.
mechanisms, and even genetic markers, perpetuating its effects across generations. So, addressing generational trauma often requires therapy, open communication, and effort, real effort to break harmful cycles. So, the question was how to break generational trauma. So while generational trauma can be deeply rooted, it's possible to interrupt its transmission. So the first thing that we need to do is acknowledging generational trauma, and that involves self-reflection, education, and an openness to understanding how past experiences with your family or your culture or history may be affecting you today. So it's really important to look for patterns or experiences that suggest that unresolved trauma may be present in your family or in your group or your community. Look for emotional patterns, for example, emotional avoidance, anxiety, hypervigilance, guilt, fear, sadness that seem to be disconnected from your personal experiences. Even behavioral patterns, a need for perfection, or overprotection or avoidance. Look for any unspoken rules in your family, any family
Hmm.
norms that discourage emotional expression or avoiding discussing certain topics, for example. Any physical problems that you may be carrying, like chronic pain that could be tied to emotional strain. Um, so, for example,
Hmm.
people seem to like examples. So, fathers who have experienced the emotional absence of their own dad
Hmm.
may become all uptight in the presence of their own children because they may not be able to open their heart, be affectionate towards their children, and so on. So they transmit this unspoken rule that maybe males cannot be affectionate, for example. So
Hmm.
we don't touch each other, right?
Hmm.
Speak to me, you can see me, but we don't touch each other. So the
Yeah.
the first part of healing is really to acknowledge
Mhm.
that I shut down, I dissociate, I armor up, and something that I react in a way that doesn't feel right and it doesn't feel like me, right? So,
Absolutely. Yeah. I mean, that's what you said, right? And I love the way you said, be aware of the unspokenness of what's happening, in the family. And the father might not say, I'm not going to get close to you. The father might not say, I'm not going to give you affection, right? But and the message that is being sent through the uptightness makes the child feel I am not available for you, and maybe leaves the child feel then you don't matter to me, or leaves the child feel lonely. And so being aware of when I get uptight, when I struggle with intimacy, when I may be tied up and my partner gets too close to me, right? And
absolutely.
to be aware of all these patterns that we definitely also bring into our adult relationships. And as a couples therapy, I can very much say that those patterns have a great impact, especially on our romantic relationships. How do I respond then to my partner's intimacy when I never received that intimacy? How do I feel comfortable in that? So, what you say, create a lot of self-awareness about certain patterns that you're noticing by yourself that maybe leave you feeling uncomfortable, or you react to it in a certain way that you notice is not good for your relationships as well.
Yeah. Yeah.
So, both of us being emotion focused therapists, what could be some practical tips you can give from an emotion focused perspective?
I always try to avoid that question
Mhm.
because it's difficult. I think the most difficult part of your healing is to actually acknowledge that what happened to you,
Mm-hmm.
trauma, right? I carry
Mm,
trauma. So in my clinical practice, that is the hardest part, right? To acknowledge and feel the impact of your trauma, uh,
mm.
to feel
Absolutely.
that the times you are more up, that wounded child inside is activated, right?
Mm,
And when I was a novice therapist, I used to be afraid of triggers, but now I quite like to be curious about them. And
mhm,
what I found really impressive is that when you get treated, you end up, I wouldn't call forgiving, but kind of getting a sense, an experience of a feeling that I am treasured as a human being. I matter, right? I'm worthy of love. And that comes with a feeling of grief of what you didn't
mm,
have as a child, or what you didn't have in your relationship, or what you're missing out now because you're getting triggered. So it's really important to acknowledge that trauma and carrying generational trauma is not an easy thing. So acknowledging, be open about it, talking about it, creating a safe space to discuss past experiences with groups, with your family, can foster understanding in your healing. If that cannot happen, creating a safe environment where you can in your therapy, community support, strengthening your cultural identity, your identity within yourself, feeling that you owe it to yourself to heal, can provide real resilience and regulation to really work through the trauma.
mm.
So,
But as far as I understand you saying is there are two important steps involved in this.
yes.
Three. Number one, allow yourself to really acknowledge that this is trauma. Because, I experience a lot of clients, feeling like, oh, this is first world problem. It's not as bad as, what happened to somebody else or something like that. So acknowledge first that what you missed, even the emotional neglect you suffered from and what wasn't there for you in your childhood, is trauma, and that acknowledgement. And that acknowledgement comes also with the acknowledgement of the emotions that come alive when you acknowledge what you miss. And some of those emotions bring up also a sense of grief of what you didn't have. So also allow yourself to grieve what you didn't have, because what you didn't have was valid to you, right? And and find a community, a place where you can acknowledge and talk about what happened, what you missed, where you can express, those emotions that are connected to what you missed and didn't have, and allow yourself to grieve that and be aware of that it matters because you matter. That's also important part. Work on the sense of I matter.
Yeah, absolutely. I mean, we used to think about trauma
Mhm.
as a huge thing, like a war or something, but unlike how we initially thought of trauma, in recent years, we come to acknowledge that trauma actually is in fact very common. Life-threatening illness or serious injury,
Mm.
childbirth, suicide attempts, domestic violence, neglect,
Mhm.
attachment trauma. So emotional, physical, sexual abuse, religious trauma, overly
Mhm.
strict upbringing. So trauma can be one event or many events, and it can be passed through generation if it's unprocessed,
Mm.
whereby universal needs are being violated. And I want to highlight that there's not such a thing as small trauma or big trauma. If a need, a universal need for love, for connection, for closeness, for acceptance, for respect, for understanding, for protection, stability, for comfort. If those are validated,
Mhm.
if those are violated,
Mhm.
then there is a trauma. It
Yes.
leaves the
Mhm.
person in a state of confusion, in a state of shutting down,
Mhm.
maybe in a state of dissociation,
Mhm.
carrying anger, and being triggered. Trigger is now a buzzword in
Yeah,
2020.
absolutely. Yes. Mhm.
So the problem with trauma is that it starts with something that happened
Mhm.
maybe 2 generations back,
Mhm.
maybe something that happened to us, but it's not where it stops, right? It
Yeah.
can be carried through generations. If,
Mhm.
you know, if and the cycle can be broken, as you said earlier,
Mhm.
and it takes one person.
Yeah. Yeah. But then at the same time, one person cannot break the whole cycle, right? You can start by then maybe learning how to be emotionally available, how to let in closeness, that to be more emotionally expressive, to feel more comfort in your difficult emotions, and kind of, also comfort in other people's difficult emotions, to learn to talk about that, to acknowledge that trauma. But it's impossible to break all patterns, right? Especially, as you mentioned briefly earlier, we know meanwhile that actually generational trauma also is epigenetic, right? It actually can influence. It's deeper than we are aware of, and it's impossible to break it all at once. I really would like to let our viewers know, not to put them under pressure of, oh, if I, get triggered again, I will never be able, because you're gonna get triggered, right? Healing doesn't mean you're not gonna get triggered anymore. It means your response to the trigger is a different one, right?
Yeah, yeah. You're saying
Mhm.
something important about not feeling that they need to save the family.
Yeah.
And I think the person who decides to break the cycle of trauma in the family or in the community or in a group, you need to understand that you're about to do something different than what the group does.
Mhm.
You're about to do something different than how the rest of the group or the rest of the
Yeah,
family has learned to be, has learned to cope, has learned to communicate, has learned to love, to survive, really. So you need to
that's so
understand.
powerful what you're saying. I love that so much. Absolutely. Hmm.
So it's really important what you've highlighted earlier that people may not get it either,
Hmm.
right? What you're
Hmm.
doing and how you're behaving and maybe even setting boundaries. People might not get what you're doing.
Absolutely. Yes. So be prepared for pushback, be prepared for feeling it's a lonely path, be prepared for not feeling understood in your family, be prepared that, your family is not gonna get it, and you might feel deeply kind of like rejected or dismissed. And so you said that you doing something different, and because you doing that, it doesn't mean everybody else understands that and else is on the same path like you.
Yeah.
So if you would give one impactful, advice to our audience, what would that be? Everybody who's kind of like in this journey, what kind of advice would you like to give them?
Yeah. Um, there's not a magic pill.
Hmm.
Healing is scary. Uh,
Hmm.
I mean, we all like the demons we know and are
Hmm.
familiar, right?
Hmm.
But also, I know that people who decide to break the cycle, there is something inside that maybe a tiny voice or maybe a louder voice that says that I want to be a person who loves better. I want to be
Hmm.
a person who connects better. So this is the agency in you. This is the healthy part in you. And healing can be a solo journey, and we can't bring everybody in the healing wagon, right? Unless they want to.
Absolutely. Mm.
So it's
So what
really,
you're saying, be compassionate to yourself, be kind to yourself. It's a
yeah,
process. It takes time, right? But the
yes,
fact that you decide to change something, to do something different, to feel something different, that's already a powerful step.
absolutely. And there's not a
Yeah.
recipe for all, right? And
Mm.
it's a real dilemma in how you need to react or sorry interact with your
Hmm.
community or with your family and what you're needing. So it's a very personal journey that you need to do with a specialist, right?
Yeah,
Sometimes.
absolutely. This is a topic I could talk about, for hours, Christina. And unfortunately, our time is almost over for today. And I love the way you really let our audience know, take it easy on yourself. Don't compare yourself with other people, maybe trying to break the cycle. And you're already brave enough to be a cycle breaker, right?
Yeah. And you will feel different because you are doing something different than the other people, than the rest of the
Hmm.
group, the rest of the
Hmm.
family, the rest of the
Hmm.
community.
Hmm.
That is the whole point of it, right? So it's really important to take care of yourself, um, to get the appropriate support, personalized support. Um,
Hmm.
and your healing begins with you and is really our responsibility and acquiring a sense of this was not okay or this is not okay and I want
Yeah.
more from my life. It's really important.
What a beautiful way to finish this interview for today. Thank you so much, Christine.